We're going to name a couple of trending skincare procedures, and we're going to say whether they are hot or not and why we think so. And I think we have to kind of start off with the most commonly used procedure that I think people have done, which has to be Botox.
I think the problem with filler is that some people just take it too far and they think if a little is good, more is better. And let me tell you that that is not the case with filler.
In some cases, it's a good thing, right? Like if you've got kind of like that potato face. In Spanish, it's called la papa. What do you call this?
I don't know. A turkey neck?
Whatever that fat pad down here.
I asked my injector if she could put filler in my nose to make like a cute little tip. And she said that I could get avascular necrosis if she injected into a vessel at the tip of my nose. And I was like, you know what? Never mind.
The question everybody wants to know the answer to is, who cares how uncomfortable it is? Does it work?
Ooh. Okay.
Welcome back, everyone, to another episode of Scrubs and Stilettos with me, Dr. Nicole Martin.
And me, Dr. Tiffany Moon.
Today, we are talking about skincare, specifically procedures like Botox, fillers, microneedling, and the famous or infamous Morpheus. So this is a topic that I love because I'm super into skincare, and I've also tried all of the above that we're going to be talking about today. But before we dive in, any new weekly obsessions, Tiff, that you have for us?
Oh my gosh, I haven't even had time to think. I've been traveling on the road so much. My newest obsession, you can't tell, but I've been putting Kion powder in my water, and my favorite one is the mango one. It tastes really good. I'm
spicy?
Terrible at drinking. No, it's not spicy. It's like almost sweet, but not like overly sweet. It's a packet. It's an individual packet. You pour it into your water, stir it around, and it provides flavor, which I like because I don't like drinking water. Like it's very boring to me. So it helps me consume water, and it also has like nutrients and electrolytes in it. So I just discovered that like maybe 2-3 weeks ago.
Oh, cool. Maybe drop the name below for our followers and also send it to me via text because I'm always looking for new ways to make my water not so boring, because I feel like if your water tastes good, you're more likely to drink more of it, you know?
Yep. What about you?
So not to be like a shameless plug here, but I just got back from Colorado, spent a week skiing. And, normally when you're in the cold and you're skiing, your lips get super chapped and dry. I have been using our Exo Lip. It is my favorite, by the way, Tiff. I've sent you some of these. I don't know if you've tried it. But
I have one. It's in my bag.
It is literally like the holy grail of lip products. Like I used to use the Laneige sleep mask at night. But since we came out with Exo Lip, it has honestly been such a game changer. I put it on in the morning and I put it on before I go to sleep. And now it's just kind of part of my skincare routine for my lips.
I love it. When I was also skiing with the kids, I did not bring anything with me on the mountain. So I got off the mountain and my face was chapped and my lips were chapped, and I just slathered it on. It's like very emollient, but not greasy. I don't know how to explain it.
The texture's awesome. Like,
yes,
it's very nourishing, but not too thick and like glossy, if that makes sense.
And there's like no scent. Like it's very, I feel like natural.
And no flavor.
I would say my only dig, and maybe you can explain this, is why is it in a pot and like not a squeezer thing? Because sometimes my hands, I like when I'm on the airplane and I just like buckled my seatbelt, I'm like, oh, I don't want to stick my dirty finger in there. So I want to like wash my hands and then put my finger in there.
So I always have like these little like spatulas with me, but I get it. Like when you're on the, it comes with one.
It comes with one, but I never have it because it's on my desk. So I want, can you make an applicator one, please?
So I will definitely note that. I agree with you, but I guess because this was intended to be a lip treatment, right? Kind of something that you do as part of your skincare and not necessarily like a lip gloss on the go. We decided to do it in a pot, but I agree with you because I always have this in my purse, and since it's mine, sometimes I just stick my finger in it, but definitely not the most hygienic if you're on the road and your hands are dirty.
Yes, but I do love it, especially like when you're traveling or if you're, skiing, those sorts of things. So agree. I'm also equally as obsessed.
So what else? Oh, health hot takes. Anything for us,
Ooh,
Tiffany? Do you have a new
okay.
trending health topic for all of our listeners? If you guys have a weekly obsession that you guys can't get enough of and you want Tiff and I to try or to share with our listeners, please make sure you drop a comment below. If you're not following along, make sure you hit the follow button so that you don't miss an episode. And we're about to start our weekly health hot takes, which is a segment where we talk about a trending health topic. We've talked about things like the GLP-1 meds and the PFASs in yoga pants. But if there's something that you're seeing on social media or that you're hearing in the news and you want us to dive deeper into that topic, make sure you drop us a comment below so that we can discuss it on a future episode.
Yes, I love this. And just so you guys know, we are physicians, but the things that we are talking about, we're not necessarily experts in that area. We're coming at you also as consumers and people who are interested in health and wellness. So this week, I would like to talk about sauna and cold plunge because it is everywhere. And I have bought into both of the things and I'm now practicing. I don't know what it's called, like the Wim Hof method. But basically you cycle, like you basically do sauna and then do like a 3-minute cold plunge. And then if you have time, sauna again and cold plunge again. So on Sundays or my one clinical day out of the OR, I will do like a sauna and cold plunge session. I think it helps with vascular elasticity. There's been some studies with sauna in particular, usually coming from the Scandinavian countries because it's like part of their cultural practice there. And it says that it actually improves your cardiovascular fitness. And in some papers, it's actually been shown to increase longevity. Now, it's hard to say like, oh, you live a few years longer if you sauna. Well, the people who are spending time saunaing probably also watch what they eat.
Correct.
Probably also get cardiovascular exercise, so it's very hard to like be like cause and effect. But I think in terms of leading a healthy lifestyle, that it certainly can be incorporated. Have you tried it before?
So I have to say, when I was living on Fisher Island, it is very much like a country club lifestyle. And everybody was doing this like steam rooms, cold plunge, alternating treatments. But it's very hard when you're working at the hospital and you have 2 small kids to find like an hour to kind of do this back and forth cold plunge sauna. So I have not personally gotten into it, but we just moved into our new house a couple months ago and we are still building out our lower level. And part of that build out is going to be a cold plunge and infrared sauna. So I'm hoping that once it's in my house and like I put the kids down, I can do it kind of like right before bed. So I'm hoping to implement it because there is some really good studies, and even JAMA, for those of you not in the medical professional, is probably one of the most highly rated medical journals out there. They published an article that talked about how sauning for at least 4 times a week for 20 minutes can it reduce your risk of cardiovascular death. And I think it is because it almost mimics exercise, right? Like when you're in the sauna, your heart rate kind of goes up. You get vasodilated, meaning your blood vessels relax. You improve circulation. You get more blood flowing through your heart and through your body. And so it's very similar to doing exercise. So if you do this 4 times a week, it has been shown to reduce your risk for cardiovascular death and probably even increase longevity, although it's hard to do those studies like Tiffany mentioned. But I think the data is very promising. So if you have the time to do sauna and alternate with the cold plunge, I mean, by all means, go at it. It's definitely going to increase your dopamine, your, catecholamines. It's going to make you feel good. So I'm looking forward to being able to do it at home.
Okay, I love that. I'm also bringing it into my home because I've been going to this place called Sweat House to do it. But now I have to like drive there 15 minutes, do the cold plunge and the sauna and then drive home. And now it's turned into like a 1.5-hour thing. And, there's no way I'm doing that 4 times a week. Like I have other things to do. So I think having it in the home will be much more beneficial.
And there's a lot of brands that have like now these kind of even like inflatable cold plunges to make it more accessible to people. So I'm looking forward to doing it.
So we'll drop a few links below for products that we think might be good for you to try if you want to start doing sauna and cold plunge.
Amazing. Now to the meat and potatoes of today's episode, skincare. So we're going to name a couple of like trending skincare procedures, and we're going to say whether they are hot or not and why we think so. And I think we have to kind of start off with like everyone's first or the most commonly used procedure that I think people have done, which has to be Botox.
Correct. So when Nikki is saying Botox, she basically means botulinum A toxin. There are other brand names. There is Daxxify, which kind of came and went. There is Dysport. Basically, they are all neurotoxins, which are meant when injected to paralyze the muscles that they're injected into for a certain number of months, usually 3 to 4 if you're using Botox. Daxxify, they said that it would last longer. I was told that it doesn't really. But anyway, they all have the same mechanism of action, is that they paralyze your muscles, which decreases wrinkles. I actually am due for some. It's been about 3 months.
No, you don't need it yet.
Here, yeah.
That's where I get it too.
Like when you can lift your eyebrows and you get these like horizontal lines, and then the 11s, which they call like when you frown. So what is your take on Botox, Dr. Nikki?
So like Tiffany said, the way Botox works is it basically relaxes the muscles so that the muscles can't move. So you have a reduction in the dynamic movement of the muscle, and therefore you don't get the creases that occur when you normally would move that muscle. I have been doing Botox for a while. I probably do it 3 to 4 times a year. I don't need to be like fully frozen or paralyzed. I'm okay having a little muscle. If you're watching us on YouTube, you'll see that I still can raise my eyebrows and I still get some little lines up here. I'm okay with that because I am a very expressionate person when I speak, and I want to have a little bit of movement. But I think as physicians, when we see patients and we're putting people to sleep, we consent them and we talk about risks and benefits, right? And anytime you have a procedure done, no matter how simple the procedure, even when you're going to get a manicure, there is an innate risk with having the procedure done. And I am going to share with our viewers a personal story about me and Botox. So I started noticing maybe like, I don't know, 4 or 5 years ago, like a weird wrinkling or dimpling in my chin that I had never had before. I don't know if you've experienced this, Tiffany, but it was kind of like a weird, I don't know, wrinkle in my chin, and it was driving me crazy. So I was getting ready to film The Real Housewives of Miami. It was my first season, and I felt like this pressure to look and be at my best when I was going to be in front of the camera. So I did a little bit more Botox than I normally did. I previously would only do my forehead and my crow's feet and my 11s. I had never done Botox anywhere in the bottom of the face. And I had an injector who I trust, this is by no means their fault, put a little bit of Botox in my lower chin. And Tiffany, my smile changed to the point that I looked like I had a stroke. For those of you watching on YouTube, here it is, guys. Can you imagine this happening like right before you're about to film a nationally televised show? And if you guys go back and you actually look at my interviews from my first season on The Real Housewives, you will notice that my face is like off and it doesn't move like the lower half.
Okay, well, nobody noticed because, like, if you hadn't have told this story, I would never have been like, oh, that's why her face looked like that. No, like, I don't think anyone noticed. But how long did that last for?
Like 3 to 4 months, the duration of what we did do is we went in and we injected a little bit of Botox intentionally on the side that was still mobile to kind of soften that. So then my whole bottom lip didn't move and I couldn't drink out of a straw for 3 months. So this is not to fearmonger and not to tell you guys not to have Botox, but really it's just to let you guys know that anytime you have Botox or anything injected into your face, there is always a risk. And then there are certain post-procedure instructions that they give you for a reason. And so if they tell you don't work out afterwards, don't rub your face, I wonder, because I always sit like this, if I moved the Botox, like by pushing on my chin. I'm not sure. I'm not sure what happened, but the point is the Botox ended up somewhere it wasn't supposed to, and I looked like I had a stroke.
Yeah, the corollary to this is please always know who is injecting. There are a lot of people who are injecting who maybe shouldn't be. Some people are licensed, some are not. But you need to look at their before and afters. You need to ask them all the questions. If someone's like kind of shushing you when you're trying to ask questions before they stick needles in your face, that person should not be sticking needles in your face. Also, this is not the time to buy a Groupon for like cheap Botox from some
Seriously.
newbie. I have had friends who, and I'm like, what were you thinking? You're trying to save $100 and now you have like ptosis, which is like a droopy eyelid, like
Yeah,
you don't
yeah.
look symmetrical. And sometimes it doesn't, the full badness of it doesn't last like the 3 to 4 months. Cause like, within like 2 months, it wears off enough that you kind of look normal. But I mean, you guys, like you can expect if you have a complication for it to last several months, and there is nothing, they cannot reverse the Botox. There is nothing they can do.
What are your thoughts on these Botox parties? Because I'm a little suspect about them. Have you ever been invited to a Botox party?
I have not. I have not. But I think in the hands of the right injector who, is a board certified plastic surgeon or dermatologist or someone else very
But do you think
qualified
the
to do
plastic
it.
surgeons are the ones doing these Botox parties? Because I'm pretty
Isn't
sure.
that who got this started? Wasn't like Dr. 90210 doing this like
I'm not
10,
sure.
15 years ago? I feel like that's who got this started because from their point of view,
I've never been invited
which
to a Botox party hosted by a plastic
we
surgeon.
we need to make new friends. No, I'm just kidding.
I'm like,
I think from the injector point of view, they can hit like 10 people and make like a buttload of money in like a very short amount of time. But I don't know, are you giving each of those ladies the individualized attention and consultation that I think is necessary? Or are you just like straight up giving like a drive-by special to everyone? Like next, you know what I mean?
I've never been to one of these, but in my mind, when I hear a Botox party, I think like 10, 15 girls or however many girls drinking wine, eating like hummus and chips, getting their face injected really quickly. And that just does not sound like how I want to be injected. I want to have a full consultation. I want you to write on my face with that white little pen, that pencil, and I want
Yes.
a full assessment. And I'm not sure that that's happening at these parties, but I understand the allure, right? For the injector, they're making a lot of money at once. And because of that, they're probably able to offer the Botox at a discount. So it sounds great for the consumer as well. But like, I think you
Yeah.
get what you pay for when it comes to cosmetic procedures.
I do too. And on second thought, like if anyone has been drinking, not that I inject Botox, would not inject Botox into them because their judgment is off. Bleeding also alcohol also increases bleeding risk. So if it's like wine night and they're all, drinking.
Which obviously, when you get 10 girls together, there's going to be wine
what
involved.
else are we doing? Of course we're drinking. Yeah, that's why I was like, wait a second. On second thought, maybe that's why we haven't been to Botox parties. It's probably not a good idea.
Yeah. So just, I think Botox is a wonderful thing. It definitely works. It helps to soften wrinkles by decreasing the dynamic movement. But I think it's gotten to the point where people don't even think about it as like a risky procedure. It's just like, I'm getting Botox done and people get it done wherever. But there is risks because the Botox can diffuse to areas that are not supposed to be paralyzed. And you can end up with ptosis or dropped eyelid, like Tiffany said. Or, you can end up with a muscle being blocked that wasn't supposed to. And then you look like you had a stroke like me. So it's not without risk. So choose your provider carefully and do your research.
I just wanted to tell you about something that I have been doing. It is an online platform called the Swell Score, and it's amazing. It's basically carefully curated health and wellness products. For example, I got my personal sauna there. It's an infrared sauna that comes with a bench. I sit inside, I sweat it out, I do my breathing exercises, and it's just so helpful for my health and wellness journey. And I love that you can get a membership to the Swell Score for only $49 a year, and it gives you 15 to 20% off of all their products.
You know what I think is so important is where you purchase your products from. A lot of people use Amazon because it's easy and you get this Prime 2-day delivery, but there's a lot of counterfeits on Amazon. Amazon has done a great job of selling all sorts of products, but sometimes you think you're buying a vitamin supplement from a certain brand, and then you get it and you realize that it's a counterfeit product. And at the Swell Score, you are guaranteed that you are getting actual legitimate products that are high quality. And like Tiffany said, you're getting them at a discounted rate. And for our Scrubs to Stilettos listeners, when you join the Swell, you're also going to get a $25 gift card in addition to the discounted membership.
Amazing. So go to the Swell and sign up with code SCRUBS to get your annual membership with a $25 gift card.
So if you guys are looking for a place to find great wellness products, water filters, saunas, supplements, please check out the Swell Score. We're going to go ahead and add the URL below. And like Tiff said, we're going to offer a discounted membership and a $25 gift card for all of our Scrubs to Stilettos listeners.
Before you just, go out and buy a Groupon, like I would Google the person you're going to be allowing to stick needles in your face. Like you need to ask more questions. And if they don't answer your questions in a satisfactory manner, then you can find someone else. Like just because you made an appointment to get Botox, once you're in that chair, if you do not feel comfortable, guess what? You don't have to. You can get up and leave.
Absolutely. And I'm so glad you said this, because do you know that it took me a very long time to feel like I could say no? I remember being younger and being at a place like, I don't know, getting my nails done and sitting there and like hating the color as soon as I saw it on like one or two nails. And I wish I would have been able to be like, excuse me, no, like I'm paying for this. Like I want to change colors. And I couldn't. I would just sit there through the whole manicure and pedicure and get my nails painted a color that I hated, because I felt just like uncomfortable or maybe insecure with like saying something, because I don't know why. But yes, you can go somewhere, not be happy or not feel comfortable and walk away judgment free. Like who cares? Your body, your face, say no.
Yeah, exactly. Okay, let's move on to the next one, which I think should be filler. I think that's the next most common beauty procedure that women do. What's your hot take on filler?
So from personal experience, I think I got filler way too young. And I think this was because it was maybe more trendy a few years ago. Like I didn't have any business getting fillers done in my early 30s. Like you're not old. Like you don't need fillers at that point. You still have a lot of collagen. Your face looks beautiful and plump. Like I didn't feel like I needed to get fillers. And then as I got older, like closer to my 40s, I felt like a lot of that filler, even though they tell you is only supposed to last X amount of time, I still felt like it was there and it had migrated. And then I kind of felt like my face looked uneven or it started to look different. So I actually went on a filler dissolving spree and tried to have a lot of filler that was placed in my face when I was younger dissolved. And now I'm more focused on skincare and stimulating my body's own collagen production and not so much putting artificial substances in. That being said, I do think in the right hands, filler can really add to someone's appearance. And I think when used judiciously can have beneficial effects or,
yes,
positive effects on your appearance.
I think the problem with filler is that some people just take it too far and they think if a little is good, more is better.
Agreed.
And let me tell you that that is not the case with filler. I have seen overfilled cheeks under the eye. It does migrate. I've seen overfilled lips. Some people are going for that look. They want to let you know that they've had lip filler. And I say, if you want that look, go for it. I am by no means shaming what another woman chooses to do with her body, but just for me, that's not the kind of look that I prefer. So I haven't had any filler in the last, I want to say 3 years, but I have tried it before because I kind of wanted to see what all the fuss was about. So where I had filler was here in my nasolabial folds. I've never had any filler around the eye. And I asked my injector if she could put filler in my nose to make a cute little tip. And she said that I could get avascular necrosis if she injected into a vessel at the tip of my nose. And I was like, you know what? Never mind. I don't need a cute nose tip. I'll just have a flat tip. It's totally fine. So again, there are potential complications with the injection of filler and everything else. And you should be having a conversation with your injector injector about like, oh, well, what are the risks and benefits? What's the downtime? Am I going to look crazy for a couple of days? Like these are all questions that you should be asking.
Correct. And, to what Tiffany just said, avascular necrosis is basically when your skin dies, necrosis, because it is not getting adequate blood flow. And that's one of the biggest or scariest risks having to do with fillers, is that if the filler is injected into a blood vessel inadvertently, it can block blood flow in that blood vessel. And then the skin that blood vessel normally supplies doesn't get enough flow, and that skin can actually start to die. And there's a very famous social media influencer that was on TV, Lily Galici, who a beautiful girl actually developed avascular necrosis after a filler injection, and she put everything up on social media, and she was luckily able to go see somebody, and they were able to dissolve the filler from that blood vessel and reestablish blood flow to the skin before that area was permanently affected. But it is probably the most scariest risk that can happen with fillers, and that's why Tiff and I stress, like, if you're at one of these parties and people are injecting fillers, do they have the necessary equipment to visualize blood vessels? Because there are some special lamps that they can use while injecting to see where blood vessels are. Do they have hyaluronidase available to dissolve that filler if it gets injected into a blood vessel? Like, these are all things that maybe you're not thinking about when you're at one of these filler parties because you're having fun with your girlfriends and you're having some wine, but they are real things to consider.
Yes. I mean, before you decide to get like Botox or filler, just go on Google and just type in like Botox gone wrong or filler gone wrong and click images and just scroll a little bit. I'm not trying to scare you, but I just feel like you should know like what the worst potential complication is, because maybe after you see that, you're like, you know what? I'm good. Like, I don't need that. It's just, I feel like sometimes people only see the benefits of a procedure and they don't see all of the risks that accompany it. And yes, they're very rare, but if it happens to you, guess what? All of a sudden it's not that rare. So, just be careful is all we're saying. Like, we've seen a lot and we just want to make sure that you guys are educated and are going into doing things like fully informed.
Yeah. I mean, God, I'm like dishing it all here, but I remember finishing up residency, and I was probably, how old were we, Tiff, when we finished residency? 30?
28.
28?
Yeah.
Whatever.
Maybe 30.
30.
Yeah.
I think I was 30. Tiff and I are 1 year apart in our training. So I think I was 30. And, residency's hard. You're working long hours and whatnot. And so as you finish, you're tired, right? Like, you've just busted your butt for 4 years working crazy amount of hours. And I felt like I had aged in those 4 years. And I remember looking and seeing like this kind of like hollowness and darkness under my eyes, probably because I was sleep deprived for 4 years. But nonetheless, I was finally making some money and I was like, okay, I want a little freshen up. Let me treat myself to a little some tweakments. And I remember I put some filler under my eyes. I went to a reputable provider to put filler under my eyes. And initially I loved it. I looked great. I looked refreshed. But with time, I started to kind of notice this blue or kind of like weird hue under my eye. And it's an actual thing. It's called the Tyndall effect. And apparently, like, the way light hits filler when it's placed like superficially under the eye can add to like the dark hue under the eyes. So then it actually made me look even more tired. And with time, I kind of felt like the filler that was supposed to be in the corner of the eye to make you look rested kind of starts migrating outward as your cheeks and you move and you smile. And then I had like a little ball here on the side that I needed to dissolve. So like, yes, I think there's a place for them, but I think sometimes, when you're chasing like, not perfection, but you're chasing like a certain appearance or something, sometimes we're our own worst enemy. And now I think I'm more comfortable like aging gracefully and just being like, okay, yeah, look, I got wrinkles. That's fine.
Yeah. Like, guess what? Wrinkles is a sign that you're getting older, which you should be grateful for. Like, some people don't get to have wrinkles. How about that? You know
Yeah.
what I mean?
No, they,
And we're just chasing this like impossible standard of beauty. It's like never enough, you
yeah.
know, like I have too much hair here and not enough hair here. I get eyelash extensions. Now I got to get hair extensions. I just got a red light helmet because my hair is thinning. I'm taking like 4 Nutrafols a day trying to get this hair to grow. You know what I mean? And it's just like, oh my God, it's exhausting, you know? So, you know, even though we're talking about this, because I think it's good to be informed, like we want everyone to know that, like, we just want you to feel like beautiful however you feel beautiful. And like my mom, she's 65. She's never had Botox or filler. She thinks that's crazy. Why the hell would she get needles stuck in her face? Like, you know what I mean? And then, you know, I'm like, oh, it only lasts 4 months and you got to go back. And she's like, extra hell no. And I'm like, I respect that. Like, I respect that. And I'm like, I wish I could be that confident, but I'm just a little bit more insecure and vain than you, mom. And I'm just going to go get my quarterly Botox. What can I say? You know, but this is a choice that I make.
Yeah. And again, I don't think there's one way to age, right? Like there's not some gold standard in aging. Some people want to fight it the whole way through and some people embrace it. Whatever your choice is, that's a-okay. Like Tiff said, we just want to talk about things, share our personal experience, let you know what our thoughts are. And I think something else that I see people do, or at least I've even seen my girlfriends do, is they'll get a picture from Instagram of like a certain celebrity or a certain influencer, and they'll take that to their injector and be like, I want my lips to look like so-and-so's. Well, girl, the rest of your face doesn't look like so-and-so's. So like what one size does not fit all. Like you know what I'm saying? Like you have to take into account like facial harmonization, right? Like what your face is going to look like with a giant lips or a tiny nose, right? Like I think that's why it's important to go to someone who is trained at assessing all of your facial features to make sure that you stay looking balanced, because you can't just treat one part. You kind of have to like look at it all as a whole.
Yes, I love that. Let's move on to talking about maybe some of the other treatments, microneedling with PRP, Morpheus 8, any other radio frequency type modalities. Have you had any of these treatments?
I have done all of the above. Like I said, I have moved away from fillers. I mean, I haven't done fillers probably in at least 3 or 4 years, because like I said, I didn't love my experience with it when I was in my 30s. And so now I'm really focused on stimulating my body's own collagen production and having my skin do as much as it can do from within. So I am going to say 100,000% hot for microneedling. Microneedling with PRP, hot, but like, especially as we get older, I don't think the quality of our PRP is necessarily as great. So like,
Yes.
if you're 60 and putting in PRP, like, I don't know.
You can do microneedling with exosomes
Yes.
instead of PRP. That might be a little bit better.
And Morpheus, I'm going to say not so hot.
Okay, tell me about Morpheus, because I know what it is. I have not had it myself. So why not so hot?
Okay, so let's start off with microneedling, because I think that plays into Morpheus, and then we'll do Morpheus. So for our viewers, microneedling is basically when you take a device and you make small channels or needle passes through the skin to stimulate your body's own collagen production. So anytime there's trauma to the skin, your body has a reaction to stimulate fibroblasts and certain cells that are going to come in to heal that trauma and build collagen. So the idea with microneedling is you're going to cause skin trauma in a controlled fashion to stimulate your body's fibroblasts to make collagen and, you know, boost all your skin's healing mechanisms.
Yes.
I love it when done in a controlled fashion by a medical provider. I'm not going to go home and be microneedling with a roller in my house, because a lot of those rollers are not medical grade. Sometimes, you know, people are rolling in a haphazard fashion and can be causing trauma to their skin that's not necessarily beneficial, and also probably not using sterile technique at home. So I don't think microneedling is something people should be doing at home on their own. But with professional hands, I think microneedling is great for your skin. The only downside to it is you typically have to do several sessions spaced about 4 weeks apart to really see the benefit in collagen production. So it's not instant like fillers. You know, you go get your fillers, you leave, and you're like, ooh, look how nice I look. This takes 3 to 4 months before your skin cycle kind of happens and the collagen picks up. So it's not instantaneous, but I do think it's very beneficial.
Yes, I think it's probably the most beneficial
Have you ever
thing that
done it?
I
Have you done
do for me.
microneedling?
I've done microneedling with PRP and exosomes, but I've never done Morpheus. I have like a pretty low pain threshold, and I was told that Morpheus hurts a lot, and I was like, oh hell no. For some reason, the microneedling like doesn't hurt that much, but I also get numbing cream put on. My friend told me that she had microneedling with no numbing cream, and I was like, what? I was like, that's like having a baby with no epidural. And she was like, girl, don't be so dramatic.
Well, we are anesthesiologists, so I think if there's an opportunity to not feel something, we're not going to.
For my patients, and I also don't like pain for me. So anything that we can do pharmacologically to take away pain, you bet I'm going to do that. So yeah, numbing cream. And then like Nicole said, it is controlled trauma to the face and or neck to stimulate your skin's own ability to generate collagen, which because of the mechanism of that, like she said, it's not going to happen right away. And it's very subtle, but it's kind of like a maintenance thing. I would say, maybe every 4 weeks to start out, like 3 treatments spaced 4 weeks apart, and then maybe go a little bit longer. Cause to me, that's like kind of frequent. I don't have time for all that. Maybe after your 3rd one, then space it out to like 8 weeks or 12 weeks. I'm due for all the things. I need Botox and I need some microneedling, but the scheduling is the problem, because I'm like in the OR, and then my one day out of the OR, I'm trying to like get my teeth cleaned, get my pap smear, get my Botox. Like that day is stacked. You guys know what I mean.
I feel you. Yep.
Yeah.
But yes, that's the regimen that I'm on. You kind of do the once a month for 3 to 4 months, and then you space it out, and maybe you do it quarterly after that. It's kind of like to stimulate the collagen, and then it's the maintenance phase. PRP, for those of you that don't know, is platelet-rich plasma. So that's when they draw your own blood and spin it down to separate the blood cells from the platelet-rich plasma, as the name says. And then that solution, the PRP, is thought to have a lot of growth factors and things that are beneficial to the skin. But as we age, the amount of growth factors in that PRP starts to decline. So the benefit as we get older from that PRP may not be that as when we were younger. Plus, our fibroblasts are also less responsive as we age to trauma and to things like growth factors. So maybe as you're getting older, 60s or 50s, it may not be as beneficial as when you were younger. But now let's go to Morpheus. Tiff, I know you're not familiar with Morpheus, but basically what Morpheus is it's microneedling combined with radio frequency. So it's this device that has a needle head, and the needles go into the skin. And while the needles are in the skin, the machine generates radio frequency and heat and stimulates the epidermis and the dermis, depending on the settings of the machine. It hurts like hell. Like when I tell you that, like I said, I've had fillers, I've had Botox, I've had microneedling, I've had lasers, I've tried it all. This shit hurts more than any other procedure cosmetically I've had. And when I did it, I had full EMLA numbing medicine on my face, and I was choking on Pronox like it was going out of style. Like I was like, and I still felt it. So on Pronox, high as all, I felt it.
So for those of you who don't know, Pronox is nitrous oxide, aka laughing gas, and you basically have to inhale it, and it takes the edge off. But like I've never been a fan of nitrous. I don't run it during my general anesthetics. At UCSF, when I was in residency, they gave Pronox to laboring women to take the edge off.
It doesn't take the edge off of anything.
I would write the order for Pronox. Then 30 minutes later, I would be setting up for an epidural. You know what I'm saying? Yeah. Like it doesn't do anything. I'm so underwhelmed with nitrous oxide. Anyway, sorry. That was anesthesia shop talk.
I mean, I don't know if it's how underwhelming the nitrous is, but it was incredibly painful.
See, that's why cause I asked my girl, I was like straight up homegirl, like how much does this hurt? And she was like, it hurts. She said, it hurts so bad that I have had clients ask if we can put them to sleep for Morpheus 8. And I was like, I mean, if you want to make this OSHA accredited, I'll bring a pro pack in here and a stick of propofol and we can get the party started. But first we got to make sure that there's rescue drugs available, airway equipment available, a defibrillator available. And she's like, oh yeah, we're not going to do all that here in the clinic. And I was like, no setup equals no propofol infusion.
Yeah. And so I think that's how bad it is. I mean, people want to be knocked out for it because it is really uncomfortable. And so I guess the question everybody wants to know the answer to is, who cares how uncomfortable it is? Does it work?
Right.
Right. And I don't necessarily think that the results were like worth all of the discomfort that I went through. And I've heard this from a lot of people that it was like, man, all that pain for results that really weren't that impressive. And I think there have even been people that have been unhappy with the results from their Morpheus. And so the thing with Morpheus is that I think you have to go to a provider that is very, very, very familiar with the technology, because there are settings on the machine that are adjustable. And you cannot treat it as like one size fits all and use the same settings on everybody, because everyone's face and skin is different. So depending on how high they turn up the settings and how high they turn up the heat, they can penetrate pretty deep down the dermis, even get to the fat layer where they're melting fat. And ladies, when you want to be young, fat in your face is a good thing. It makes your face look round and robust, and it makes you look younger. You don't want to be melting the fat off of your face, at least usually. So I feel like there's this thing called the Morpheus melt, where people felt like their jowls and their cheeks and their under eye area was kind of like sagging and falling after the Morpheus because they had experienced that Morpheus melt. Now, in some cases, it's a good thing, right? Like if you've got kind of like that potato face, like that jowl, that, what is it called? In Spanish, it's called la papa. What do you call this? In English?
I don't know. A turkey neck? I don't know.
Whatever, that fat pad down here. If you have that, well, the Morpheus melt could be good for that. But like, you don't want to melt your cheeks. Like, people pay a lot of money to have good cheeks.
Yeah, but
right?
we're trying to fill our cheeks, not melt the cheeks. Yeah, it's crazy.
So I think that's the thing with Morpheus, is that you have to be really careful with the person you go to. They have to understand like the different settings, and they have to adjust the settings as they're going through the different areas of the face, right? Because skin on your forehead is different from skin in your cheeks, which is different from the skin in your neck. So they constantly have to be adjusting the settings as they're doing the passes. If your provider's not doing that and not talking to you about what your goals are in each area, like, you need to be very weary about that.
Yeah. Are y'all catching a theme to everything we're telling you? Basically, do your research, make sure who's doing things to your face, like, be an informed consumer, right? Don't just go in with like rosy colored glasses thinking that you're going to come out looking like the new Lindsay Lohan. You know what I mean? Like,
although she does look great.
Oh, she looks amazing. You know, I'm like, if I stop drinking alcohol, like, will I have that too? But I think she had some work done.
I mean, she got
amazing.
some really, really good work done. She looks fabulous. Something else about the Morpheus is that I'm Hispanic, so I tend to have a lot of melanin in my skin, and I do tend to develop melasma. I had it with both of my pregnancies. And the Morpheus, because it does emanate heat into the skin, if you have skin that's prone to melasma, you need to be aware of that, because it can exacerbate melasma. And there is this thing called post-inflammatory hyperpigmentation that some people have experienced with the Morpheus, where they end up getting worsening of their melasma and some hyperpigmentation. And these are important things to talk to your provider about. If you're prone to getting melasma, you know, that's something to mention, so that maybe they use milder settings and they don't turn the machine up as high so it doesn't get as hot, or they use some sort of like a cooling fan afterwards. Lots of different things that you can discuss, but the more you know, I think the better decisions you can make.
I agree. And we didn't cover it today. We can cover it in a future episode, but you can't just do these treatments that we're talking about and do nothing else and be okay. This is sort of like the big procedures that you do every quarter or semi-annually, but in between, every day you have to have a good skincare regimen, and you have to be putting SPF on your face. We're going to have a whole nother episode on that. So if you guys have skincare type questions, you can drop that and and we'll make sure to address the questions. But right now we're just talking as sort of like the foundation of good skincare. And then every day you have to, maintain with the serum, a moisturizer, maybe a retinoid if your face can handle that, all those sorts of type of things.
Yeah, absolutely. It's kind of a combination, right? But at the end of the day, your skin is your biggest, largest organ in your body. So you need to take care of it, especially like Tiff said, with SPF and your daily skin regimen. And then, yeah, these are kind of things that you can do quarterly or biannually to kind of maintain collagen production and kind of optimize your skin's appearance.
Yeah. And I feel like when my skin is good, I can put my best face forward. Like right now, I just have a tinted moisturizer on that has a little SPF in it. It's probably not enough, but I've been inside an auditorium all day for my kids' cheer competition, and then a little blush and some fake eyelashes, and I'm good to go. Like as busy moms, anesthesiologists, entrepreneurs, I don't have time to be doing like a full face of makeup every day. So when I keep my skin looking good, I feel like I can do bare minimum makeup look and still be ready to go out and be seen.
Oh, absolutely. I always say that it's not so much the paint, it's more about the canvas. And so if your skin is looking good, it's flawless, your pores are small, you're not breaking out all the time, like you can just put the slightest amount of foundation on and it just like glows and it looks great. So yeah, I think doing a skincare episode, Tiff, would be awesome in addition to this. And again, guys, this is not to bash Botox, fillers, microneedling, Morpheus. I think, like I said, in skilled hands, they can all be great tools in your beauty arsenal. But just, be cautious about where you're going, ask questions so that you can make the most informed decisions.
That's it for today. If you guys are not yet following us on Apple or Spotify or however you're listening to us, please follow and leave a review so that we can continue to grow and serve you.